Hi everyone, and welcome back to the Hair Loss Show, episode 65. In today's episode, we're going to talk about a relatively new technology. It's been on the market for a couple of years. It's called Rigenera, and how we use this as part of our practice and where we found it to be of benefit. So stick around and we'll go through that.
Welcome to the Hair Loss Show. Dr. Russell Knudsen and Dr. Vikram Jayaprakash discuss issues relating to hair loss and the medical and surgical treatment of hair loss in both men and women.
Hi everyone, thanks again for watching. In today's episode, we're going to cover a topic called Rigenera, or a product called Rigenera, that's been on the market for about 2.5 to 3 years. We've recently, incorporated into our practice and what we do. So I thought I'd unpack it a little bit and talk about what it is and how it's used, and the scenarios in which it can be used, and where the benefits and limitations are. So, first of all, I have no vested interest in Rigenera. I'm not an advisor, or I'm not I have no financial benefit from there, but we do offer the service here at our clinic. So, Rigenera in essence is we talk about stem cells, and I don't want to get too technical in this discussion, but we talk about stem cells, and really stem cell therapy hasn't, come into play yet. With regards to hair. Stem cell, effectively what you're trying to do is you're trying to get a certain group of cells and get them to change into a population of cells that you want them to. So for example, you may want for them to change into muscle tissue, or you may want them to change into skin, or in our case, hair. So there's been a lot of problems that both mechanically trying to sort it out, also ethical issues with the use of stem cells as well. So Rigenera is a technology that's sort of moved away from that slightly. It doesn't use stem cells in its stricter cells. It's basically using a concept called autologous grafting. And that's been used for many, many years, which is using a pre-populated set of cells that are programmed to do what they are meant to do. So you're not trying to get them to do a variety of different things. You're getting those cells to do what they are already programmed to do. An example of this that's been used for many years is skin grafting. So we take skin from one part of the body and put it over a wound in order to help promote wound healing in a particular part. So what they're doing is a similar sort of technique with Rigenera. So in essence, and again, I don't want to get too technical with it, but what they're doing with this technology called Rigeneracons is that they are taking a bit of tissue. So they take a 3mm punch biopsy from the scalp and effectively grinding it down, for want of a better phrase, into smaller particles that are 80 microns in diameter. And they have a particular machine that does that. And so you have at the end of that, you then distill it, and you have in a syringe, you have a collection of progenitor cells and growth factors as well that are specific to that population, to that body part. So they've been using Rigenera in a variety of different scenarios, for example, bone grafting, skin grafting, etc. And now they've brought it into hair as well. So you can take scalp tissue with some hair in it, and then grind that down and collect and then filter it through and correct your cell population with your growth factors. And then what you can do is you can inject it back into the scalp to promote hair stimulation. I don't want to say hair growth. I think stimulation is probably a better word, because I still maintain that you can't inject anything or rub anything on the back of my hand and make suddenly hair grow at the back there. But you can stimulate existing populations to grow. So it sort of works in a very similar vein or method to PRP, in that using growth factors to stimulate the area. Probably where it's slightly different is that you're using hair-specific growth factors, hair-specific progenitor cells to do that. So that's basically in a nutshell. You take a sample of scalp and skin and hair, you grind it down, you filter that, you get your collection of fluid, and then you inject it into the area that you want it to be effective. It's done as a surgical procedure in theatre. It doesn't take very long. It takes about half an hour to do. So where is it useful? So there's a couple of scenarios where it's used. And so I think initially the company was designed to use it as a singular therapy. So if you're someone that's losing your hair, have Rigenera injected into the area. And I think, you know, you look at the data, there's been some success. And I guess similar to PRP, it's very much dependent on patient selection. If you've got someone who's got quite extensive male pattern hair loss, quite aggressive male pattern hair loss, then it's probably not going to be as effective as someone who may be, you may get early on in the piece. It's potentially where I found it useful is people who don't want to take medication or not keen or have had issues with medications such as finasteride. This is another alternative therapy. Again, if you look at, we talk about therapies of blocker therapy and stimulator therapy, I'd put Rigenera under the stimulation category as well. So certainly for someone who doesn't want to take medication, then this is a potential option for them as well. I think it's very good, and there's been a lot of data, and I've got a lot of colleagues as well that have been using it on women that suffer from female pattern hair loss. Again, because we're not really 100% sure about the causes of it, of female pattern hair loss, and what is the most effective therapy. Rigenera can be used in that scenario with some good effect as well. Again, really depends on patient selection, and I think if you can get the patient selection right, then the results are obviously more significant. Now, one of the other ways that we're using Rigenera is in combination with hair transplant, and this is what I'm also very excited about, because what a lot of what we do is hair transplant surgery. But when you combine it with hair transplant surgery as well, it seems to be quite effective from that perspective. So first of all, how is it done? So if you're using it with hair transplant surgery, not so much benefit to do if you're doing it with FUE. All right, it's best if you're doing it with strip surgery. Why? Because what you do is you take a little bit of extra tissue when you're doing your strip surgery. So you take an extra 30, 40, 50 grafts. And also when you're doing strip surgery, you also, when we're dissecting the strip, there's a little bit of extra fat tissue. Normally we dissect the grafts and we throw the fat tissue away because it's waste. But we can use some of that fat tissue as well in the Rigenera machine and get more fluids, because the fat cells contain some of those progenitor cells and the growth factors as well. So we can use that to our advantage. FUE is different because you don't really get much excess tissue that you're from that procedure. So you can take a few extra grafts, you can use the fat cells, the fat tissue that you're going to discard anyway, you can make up a few syringes of the Rigenera fluid and then inject that into the recipient area. Once you've planted the grafts, you can gently inject it into the recipient area and apply a little bit topically as well. And what we've found from that is that the growth of the grafts certainly can be faster. So the timing from transplant to endpoint has significantly reduced. Also, what we're seeing is that the grafts are now becoming a little bit more sturdy and a little bit more hardy as well. And so there is a benefit from that perspective. Obviously, the downside is that there's an additional cost from a surgical perspective, but some people find that to be of benefit. So I think there's a variety of different scenarios in which Rigenera can be used. I don't think it's a panacea by any stretch of the imagination, and it's certainly not going to replace hair transplantation. I don't think it's certainly going to replace medical therapy in its current iteration, but it can, I think it's another sort of arrow in our quill that we can use to manage these conditions. So I hope that answers the question. We've had a few people asking about Rigenera, so I thought I'd do the video on Rigenera and where I see its use going forward. Like I said, it's been around for a few years, but it's something that we've recently sort of started after we've seen the results and people that have come through that, and I think there's some benefit there. So thanks again for watching. Hopefully that answers that question, and we'll see you again on the next episode. Take care.